Hello everyone, this is Harshita from MASH Project Foundation. I welcome all of you to today's panel on Cancer Se Azadi in partnership with Daily Hunt and UV Can Foundation. In 2021, India witnessed more than 25 million cancer cases. But the cancer survival rate over the last few decades in India has improved significantly. As we celebrate 75 years of Indian independence, that is, the Azadi Ka Amrit Mahotsav, we must also celebrate the progress that India has made over the years across different areas. With that spirit, I am happy to have all of you here to celebrate Cancer Se Azadi with us. And I introduce you to our moderator, Sneha Banerjee, who will take this forward. Hi, Sneha. Happy to have
Hi,
you here.
Harshita. Thank you.
I would also like to introduce our esteemed panelists. We have Mrs. Poonam Nanda, the founding member of UVCAN and a cancer survivor herself. We have with us Dr. Kedar. He is a nodal officer with the Directorate of Health Services. We have with us Dr. Paramjot Bindra, who is a palliative care specialist, and she comes with a lot of experience in this sector. She is also the vice president of NAP CAIM Punjab chapter. We have with us Dr. Anupama. Hello, ma'am. Welcome to the panel. Dr. Anupama is the head of department from Goa Medical College. She's an oncologist. And we have Krishnendu with us, who will join shortly. Krishnendu is also a cancer survivor and a beneficiary of the UV Can scholarship. So I hand over to you, Sneha, and looking forward to this conversation. Thank you.
Thank you so much, Harshita, and welcome everyone to this esteemed panel. We are very, very excited to have everyone on board and discuss a topic that is so relevant in today's times because this is an ailment that spares no one. No, it does not look at gender, it does not look at age group today. And as Harshita mentioned initially, that though we have the relief is that the survival rate has really, really improved over the years. We've come a long way in the capacity of healthcare facilities and the research around cancer and its comorbidities. I would like to start by asking, Dr. Anupama and maybe bring in Ms. Nanda as to talk about a little bit about how do you see the journey of cancer as an ailment and its cure in India. What has been your experience, and how do you see the progress so far since the last, say, I don't know, 40 years, 50 years?
So, thank you. I'll start by thanking the organizers for inviting me on this esteemed panel. It's a pleasure to be here and to share my views with this August gathering. So, it has definitely been a very exciting journey over the last 40 years, and we look forward to the next 40 years to be far more exciting than what it has been. So we started systemic chemotherapy, that is the systemic therapy of cancer by with injections and tablets somewhere in the late 50s, which was early and late 50s when they discovered some drugs during the Second World War. And that is when the planned treatment of childhood cancer was first initiated. They found that with one drug called 6-MP, some of the children survived for a few months. Then they found that if they combine that with a second drug, they survive for some more months, and then they found that they give three drugs instead of two, they would survive for a couple of years. And that is how we learned how to combine different medicines for cancer treatment. And since those early trials of the 60s and the 70s, we have indeed come a very, very long way. Like at that time, the survival of children with blood cancers, leukemias, was to the tune of 20%. Today we can very proudly and confidently say that for childhood cancer, leukemia, the survival rate is to the tune of 85-90%. So we've indeed come a long way. There have also been simultaneous improvements in surgical techniques, asepsis, transfusion services, all of which has contributed immensely to the improving the survival of patients with cancer. And now,
Right.
in the last 1 decade, we have immunotherapy come in, targeted therapy come in, which is making treatment not only more effective but more safer, easier, less painful for the patients. So definitely these are very exciting times for cancer specialists, and we look forward to having better cures for patients with cancer.
Right, Miss Nanda, you're with the UVCAN Foundation, and you're seeing
Yes.
cases day in and day out. What has been your experience from the time you've launched the foundation, or before that, you being a very brave survivor yourself? What has been your thought process about the journey of cure and treatment around this ailment in India?
Yeah, hi everyone. So, yes, I'm a cancer survivor myself. Faced this disease first in 2009 and then again in 2018. And that's one reason for being very strongly associated with the foundation. And the foundation, as everyone knows that UV went through cancer after the World War. I mean, the World
World
Cup
Cup.
for him.
Yes,
For him, it would be like a world war, I guess.
of
So
course.
2011, you win the World Cup. You're the man of the series. The world is at your feet. You have everything going for you. And then suddenly one fine day, the doctor tells you you have cancer. So, everybody was like in a state of shock. But anyways, UV came out of it victorious, and then he thought that he was lucky enough to get the best of the treatment. But in India, we are lagging behind, especially with the marginalized community. It's very very tough for them. So that's how the foundation came into being. And I would say, I would support Dr. Anupama when she says there's so much going on, because the kind of treatment I went through in 2009 and then again in 2018, there's a huge difference.
Huge
In
difference.
the
Yeah.
yes, yes, absolutely. I mean, the surgery was so much easier. The precision of the things that were being done were far less invasive, far less, yeah, time taking. The radiation was so much more scientific, and it took far less time. So in 9 years, a, there was a huge change. I mean, why talk about 9 years? I think every 9 months, 9 days, change. There's so much research going on, and I think we still haven't won the battle against cancer, but I'm sure we'll get there with people like Dr. Kedar and Dr. Anupama and Dr. Paramjot. I'm
Yeah.
sure we will get there. Yes.
No, and it's glad that you brought this up. That though there's no freedom really from the disease, because as per the ICMR statistics, numbers are only going to get bigger, and more cases. 1 amongst 10 people are going to get infected with this ailment. But the positive side here is that the increase in survival rates, and I would like to bring
Absolutely.
in Dr. Kedar here to tell us about how does public health services or the NGOs, how do all these organization systems come and would like to contribute towards this improving the survival rate and tackling the increasing numbers that are projected going forward for this ailment. Sir, I think you're on mute, Dr.
Yeah,
Kedar.
thank you for inviting me today for today's panel discussions. It's really I'm really happy to be a part of today's discussion. Firstly, I would like to thank Yuvraj Singh Foundation, UVCAN, and SBI for making part Goa as a part of their pilot project with regards to eye breast screenings. Goa is more westernized. We are having a lot of incidents and cases of breast cancer, all non-communicable diseases. May it be diabetes, may it be hypertension, may it be cardiovascular diseases, and so breast cancer thing was one of the things which our honorable health minister was very much interested, and we were fortunate enough to have UVCAN Foundation and SBI coming, extending their support and hand in collaborating with government of Goa. So with regards to, where are we standing now and what can we do with regards to implementing this Swastha Mela, Swastha Goa project in Goa? we are doing it for last in between we had COVID, and then now we are moving on a right track. So that whole target of eye breast screening is for Goa is around 1 lakh of ladies we are planning to screen in next couple of years. So we have got 1.5 year left to complete the whole project. So that is one thing, and till now we have done around 21,300 odd screenings, and out of those 21,000 odd screenings, uh, we have come across ladies who are having lump. Around we are having around 630 odd cases with lumps, and out of those, to their bad luck, we have come around nine positive breast cancer patients. So all of them have been referred to higher centers. Many of them have undergone surgeries. Many of them are on chemotherapy, and some of them are on radiotherapy. We are doing this project. Director of Health Service in association with Goa Medical College, Dr. Anupama Borkar is there. She is a medical oncologist. She is coordinating from the JMC side. So this is the right now the status of the programs, and how to take this program forward is a couple of things. We are just out of 1 lakh, we have screened around 21,000 now. So we are looking ahead, collaborating with different agencies, different government organizations, different departments. Then we have got women and child development, we have got agriculture departments, then the NGOs are there, we have got self-help groups. We have got a concept of health and wellness center. Under health and wellness centers, one of the important component is screening of ladies with regards to breast, cervical, and oral cancer. These are the three common cancers which the Ministry of Health and Family Welfare has directed. So we are also screening patients under that. So that's how we are taking this program forward.
So, Dr. Kedar, if I may ask here, are people apprehensive to take the test from what you have experienced so far? Would you like to shed some light on, are people approachable? Do they want to take the test, or they are like, we are safe, we don't have any problem? What is the mindset really out there?
Yeah, I mean, before Dr. Kedar says, let me tell you that it's not easy. People have so many fears in their heads, and even, I mean, forget about the time when you don't know that there's anything wrong with you. Even when people get to know that there is something wrong with them and that they need to get to the doctor, there is this huge amount of inertia and delay that things will be okay. This isn't happening to me. This is something different. So it's a huge mental battle that one has to fight with the people out there, whether it's to go in for and this process that we have in Goa is completely painless. It is radiation free. There's absolutely no issue. But to convince women to get inside that room to get themselves tested is a job in itself. I'll say that. So over to you, Dr. Kedar.
Right. Dr. Kedar, would you like to add something to what Ms. Nanda just mentioned?
Can you come back with the question, please?
So, do you see what kind of response do you see from people when you kind of reach out to them to test themselves, screen themselves for the
Yes.
ailment?
Yes, as what ma'am has said, it's absolutely right. Reaching out to people, convincing them, is a task in our hands. For that, we have put the whole team we have got around 8 to 10 people from Yuvraj Singh Foundation employed at different levels, both North Goa district as well as South Goa districts. Uh, there's something, information has to be percolated till the grassroots level. That's one of the things.
Sure.
So we are conducting awareness programs at different levels. There are different forums which we get wherever we have good number of clienteles attending, may it be OPD level. So we target them. We have got at all the health centers. Goa being a small state, we have got district hospitals too. We have got sub-district hospitals too. Then we have got CHCs around 6, and then around 24 we have got bedded hospitals. So we have got a good, strong team of. There's something called IEC officers, which is Information Education Communication Officers, and as well as counselors. So we are fortunate enough that the UVCAN Foundation has trained the doctors. Then we have got a lot of Ayush doctors under us. They have trained a team of doctors from right from district hospitals to the primary health center level. The team of doctors have been trained very well. We have also had rigorous trainings with regards to what right information has to be given to the beneficiary or to the lady who comes to be to the health center, or to the OPD level, or maybe campaigns approach whenever we do. What right message has to be done, given? What's the
Sure.
importance of self-examination? That also is given, and even
So
the
yeah,
yeah,
I'm
even
just
the
coming to that
counselors,
self.
yeah, even the counselors have been trained with regards to pre and post counseling also.
Sure, sure. I was just coming to the self-examination, and I would like to bring in Dr. Paramjot and Dr. Anupama. I'll start off with Dr. Paramjot here. Uh, as Harshita mentioned initially, that the cases are just projected to go upward in the upward direction. So, we Daily Hunt as an app has an audience that probably does not is not centered around urban population alone. It has the tier two, tier three audience that's probably watching this video today and would want to have information around this, awareness around this. Could you shed some light as to when, why, what is the approach to kind of take preventive measures, and take self-assessment tests, go to the doctor? Could you shed some light around that, Dr. Paramjot?
Good afternoon, everyone, and thank you so much to the organizing team for having me on this platform and with the pioneers in already working in this field. So definitely, the screening and early detection and prevention is very important for the cancer. So we like breast, cervical, and oral cancer. These three cancers can be avoided if we done all the testing and screenings on right time. So if I take about the breast cancer, self-examination after the age of 20 years is very important. So anyone if find the lump in their breast or the heaviness, so they can approach to their gynecologist and they can get the examination done. So it's a very safe and a painless procedure to get it done, and there's nothing that would happen to you. And there is a myth like if we go to the specialist and then if we get the test done, so might we get the cancer or something like this. And then if I come to the oral cavity, so if you're having any lesion or something in your oral cavity, or there's something like difficulty in opening your mouth, you should get it done, testing done with your either with the ENT specialist or with the oral surgeon or with your physician. And then coming to the cervical cancer, so there is a HPV vaccination available, so I recommend everyone to get it done, all even including males should get it done. So if I talk
Yeah.
about the vaccination, yeah, so if I talk about the Australia, Canada, it's already in their national immunization schedule, but it's not here in India. So whosoever between the age of 9 to 25 years of age should get it done as soon as possible to avoid the cervical cancer. So these three cancers we can avoid at very early level, and we can do all the necessary actions.
Thank you, Doctor. Dr. Anupama, I would like to like your opinion on this as well. There is a lot of stigma in our society कि अगर checkup भी लोग नहीं करवाते, people start scared and apprehensive कि okay, we'll go for a fever checkup, we'll go for a dermatologist, if there's a pimple, we'll go check that with a doctor. But when it comes to something as crucial as this, which is so common today, how do families break that stigma, Doctor?
So we can only do it with increasing the awareness and by good education. It is very important that women should learn self breast examination and do it right from the age of 20. I say this because today we see women as young as 23, 25, 27 come in with get diagnosing with breast cancer. So self breast examination should become a habit. And it is very easy, it is very simple. Once you learn it and you make a habit out of it, doing it every month, in the first few months you don't realize much, but once you know the feel of your own breast, and then there is a change you can easily make out. Then comes physical examination by a physician or a doctor or a gynecologist, which usually is advised after the age of 40, and so is mammogram. The first mammogram should be done ideally around the age of 40, and after that, every once in 2 or 3 years. Now, those women who are at high risk because they have family history of breast cancer or any other cancer, especially ovarian or uterine cancer, or if women who have had some other cancer early in their life, should start with mammography much earlier. But that's a very small subset. So for the general population, you should start self breast examination at the age of 20 and mammography screening at the age of 40. If we do this, we will be able to diagnose cancers early. But more important than that is the fact that if you feel that something is just not right, like you feel a lump, you feel heaviness, you feel something asymmetrical about your breast, some discharge, something which is not, then at that point you should not hesitate to seek medical advice at the earliest, because it could be an early stage, and if you ignore it and if you let it grow, if you let it fester, it might be too late. So the one is, of course, being aware of your body, doing self breast examination and mammography. And the second thing is that whenever you notice something is wrong, you should not hesitate and you should not waste time. You should seek medical opinion at the earliest.
Right.
Yeah,
Miss
Sneha,
Nanda,
I just,
yeah.
yeah. Please tell me, what were you going to ask? I was anyways going to add to what Anupama said.
No, ma'am. I think I was just going to ask about the stigma part of it, because that I mean, for our larger audience, whether it's
Yes.
male or female, or young or old, how do we break that in our families? Please do add, Miss Nanda.
That's what Anupama said just now, that there's awareness that needs to be brought in, and you need to tell people that if you have cancer, it's not your fault. I mean, stop blaming yourself and stop hiding in the closet. And even today, I mean, like, I do so much of work around awareness. I talk to people, try and help them out. And if friends and families, if there's a case anywhere, they'll very sheepishly say, ki, Poonam, so and so is not well and has cancer. Can we please, ask them to come and speak to you or have a chat over the phone? And I tell them, yes, why not? I'm telling you, I teach in a university. I have 4,000 kids here, and I use my examples as my strength. When I talk to students about resilience, about fighting back, I haven't hidden it from anyone. Everyone knows that I've fought this battle twice over. So it's the awareness, and now my students, even my boy students, I mean, they talk about breast cancer and things like this, menstruation and everything, like they're sitting and having a normal conversation. So that's what I
Right.
think we need to do.
Yeah,
And
to have the
talking,
norm.
yes, to have
And
normal conversations.
do you think, ma'am,
Yeah,
when you speak about normal conversation, it's when a known face, like say Yuvraj Singh, or the celebrity is the actors, the sports people, when they come out and talk about their journeys, has that helped in breaking the stigma?
definitely, definitely. Recently, we were in conversation with Chavi
Mm-hmm.
Mittal.
Yes,
She's
Chavi Mittal.
also,
Yes.
yeah, she's got a huge fan following. मेरी भी fan following बढ़ गई जब मैंने उसके साथ बातें की.
Mm-hmm.
Plus side of it. But when she talks about it, or when somebody like Yui comes out in the open and talks about it, yes, definitely, because
Yeah.
he's got everything going for him. He's the man of the match. He's the man of the series. He's young. He's healthy. He's fit. And then suddenly cancer strikes. What is his fault in it? Hey, nobody can accuse him. He doesn't exercise or doesn't eat the right kind of food. So if it
Yeah.
has
Absolutely.
to happen, it will happen. And the second thing I want to tell about early detection is that, that is something like Anupama said, you just have to be careful that your body is sending you some signals. The signals I got from my body, but nothing can serious. There was no inverting of the nipple. There was no, discharge, nothing. I had strange tingling sensation down my arm. And my husband would laugh and say, it's the right side, so at least you're not having a stroke, not realizing that there was a cancerous lump over there that was bothering me. So, and the
Right.
second time when I had it, I had just gone for my checkup. I did not even know that there was something wrong with me, and they found this tiny little lump in the other breast, and they found it to be malignant. And my doctor said,
Mm.
"You're very lucky. That not even 2% of Indian women find it at this stage when it's not even palpable." And that's what saved
Right.
my life, because I went for regular checkups. I was aware. God knows आगे क्या होना है, but so far so good.
That would, ma'am. I think.
I'll just add on to this. I'll just add on to this. I mean, we normally have intersectoral meetings. So this
Mm.
is just an example. So intersectoral meetings we were having with Anganwadi workers. So a group of around 35 to 40 ladies had come to the health center, and since we had a doctor, and since the meeting was over 1 hour prior, so we just finished the meeting, and subsequent to that, we just requested all the ladies, around 25 ladies, just to get a scan. And to the good luck or a bad luck of that particular lady, as Madam Nanda rightly said, I mean, we found a lump, and when the FNAC was done, she came positive. and after that she has undergone surgery, and right now she's on chemo from GMC, and she's doing fine. So as ma'am has said, just a casual eye breast scans, lump was found, patient was referred, follow-up was done,
So,
this surgery was done, and then she's surviving now. So these small
so,
things matter a lot.
so Dr. Kedar, if I may just ask here, does the cost or the cost of it, the time that it takes to cure the ailment, prevents people from actually getting tested? Is that a possibility, especially in the section that you're working with?
The cost wise, definitely. I mean, it's. I mean, ma'am, Dr. Anupama can speak about it much better. But under this, what we are doing under UVCAN Foundation and what we are doing, it's absolutely free. Like healthcare, I'm talking about state of Goa. It's absolutely free. We don't charge anything. May it be everything has been covered under. Most of the Goan population is covered under by insurance, state insurance, Deen Dayal insurance. So also we have got PMJY, the central schemes, and even in GMC, there's absolutely no cost added. In case in case the patients need higher referrals, might be to Tata Hospital or out of Goa, the patients are referred under Mediclaim and all other schemes. So cost-wise, absolutely, only the patient has to be made aware
Yeah.
as to what facilities are available where and when they can be referred. And we have got a strong team for good networking, both forward referrals and backward referrals, so that we can keep a check on the patients for follow-up.
Well, thanks for putting this out, doctor, because I think a lot of stigma is associated that once you are diagnosed with the disease, the expense to cure the disease is huge. That's the general, notion. I would like to bring in Dr. Paramjot and Dr. Anupama here again, and we have Krishnendu joining us.
Yeah,
Doctors and doctors,
Sneha,
sorry.
sorry for the interruption, but Krishna is kind of getting in and getting out. So now that he's here, do you want to ask
Sure,
him something? Because he keeps dropping
sure.
off due to bad network, and he'd be hugely disappointed if he wasn't able to say his
So no,
two
definitely,
words. Yeah.
definitely, Krishna. Krishna is a brave survivor, and we would love to hear your journey and आपने कैसे इस दौरान अपने आप को मजबूत रखा और जिंदगी क्योर होने के बाद कैसे गुजर रही है? आप थोड़ा अपनी जर्नी के बारे में बताइए.
First of all, good afternoon, everyone, and thank you, everyone, to inviting me for this webinar. And my name is Krishnendu Das, and I am 20 years old. 28 years old. And during the treatment, every survivors, every cancer patient facing up lots of pain, and बहुत से लोग आपको इग्नोर करते हैं.
जी, जी,
Your
बिल्कुल.
friends, your teachers, your siblings, everyone. But मेरे साथ थोड़ा बहुत ऑपोजिट हुआ. मेरे नेबर्स ने मेरे को बहुत हेल्प किया. मेरे siblings, मेरे भाई बहनों ने मेरे को बहुत सपोर्ट किया. And especially my mother and my father. And after survivorship, मुझे बहुत सारे स्टिग्मास का फेस करना पड़ा. लाइक मुझे अगर मैं थोड़ा सा भी बीमार पड़ता था, मुझे स्कूल से ऑफ लेना होता था, तो मैं 1 डे के लिए नहीं 1 वीक के लिए ऑफ लेता था. सो उस टाइम मेरे पास मेरी इम्यूनिटी बहुत वीक होती थी. इवन डेफिनेटली अभी भी मेरी इम्यूनिटी इतनी वीक है. तो
Sure.
बट मैं उसको इतना ज़्यादा प्रेफर नहीं करता. उस टाइम में आफ्टर ट्रीटमेंट जब मैं 6th में था, तब मेरी तबीयत बहुत ज़्यादा खराब हुई थी. तो उसके बाद मेरे फादर भी एक्सपायर हो गए. सो मेरी मदर को कॉल किया जाता है कि ये इतना ज़्यादा स्कूल में ऐसा क्यों कम क्यों है, अटेंडेंस क्यों आती है, क्यों कम आता है, ये क्या है. तो मेरे मदर ने पूरा खुल के बताया. प्रिंसिपल ने ऐसा रिएक्ट किया कि जैसे लाइक मैं एक एलियन. बट मेरे टीचर्स ने मेरी प्रॉब्लम को समझा, मेरा रिस्पेक्ट किया. सो उन्होंने अलाउ किया. देन मैं फॉलोअप्स के लिए जाता था, तो उस टाइम पे फॉलोअप्स पे सारे टेस्ट होते थे. सो टेस्ट इट्स वेरी पेनफुल एंड ट्रीटमेंट के दौरान भी बहुत पेन झेलना पड़ता था. सो फर्स्ट क्वेश्चन मेरा ये है कि अभी तक वही जर्नी चल रही है, पेन पेन फ्री ट्रीटमेंट का हम बोलते तो है, बट पेन फ्री ट्रीटमेंट अभी भी हमारे पास नहीं है. सो इन फ्यूचर क्या इसका कोई सोल्यूशन है, या आने वाले टाइम में इसका कोई सोल्यूशन है? एंड मेरा क्वेश्चन सभी डॉक्टर्स से, आपने जैसे बोला कि ब्रेस्ट कैंसर क्यूरेबल है, सो सर मुझे इस एक चीज पूछनी है कि क्या इसका बेस्ट ट्रीटमेंट क्या है, सर्जरी और नॉन सर्जरी? बिकॉज मेरे एक कजन है, उन्होंने 2 साल पहले ही अपनी वाइफ को कैंसर के दौरान खोया है. सो व्हाट इज द बेस्ट ट्रीटमेंट एंड फॉर ब्रेस्ट कैंसर पेशेंट, एंड वो ट्रीटमेंट हम क्यों नहीं यूज करते?
Dr. Anupama can speak about it. I mean, she's the right person.
So, Krishnendu, first of all, we appreciate your honesty and we appreciate your strength and your spirit with which you are now facing the world, and you're proud that you are a survivor, and we are proud of you.
Thank
Uh,
you.
I know that cancer can be a very, very tough journey. It can be a very painful journey. And as I said in the beginning, we are now coming up with newer medicines, newer modalities. There are more and more oral tablets. Like आपका जो दर्द होता था वो ज्यादातर इसलिए होता था कि आपको आईवी कीमोथेरेपी मिलती थी, इंजेक्शंस मिलते थे, इंजेक्शंस पेनफुल होते थे. उसके जो साइड इफेक्ट्स होते थे, मुंह में छाले आते थे, लूज मोशंस होते थे, गले में दर्द होता था, निगल नहीं पाते थे, ये सब जो साइड इफेक्ट्स होते हैं जिसकी वजह से आप कहते हैं कि ट्रीटमेंट बहुत पेनफुल होता है. तो आजकल बहुत सारी ऐसी मेडिसिन डिस्कवर हुई है जो कि इंजेक्शन के बजाय हम पेशेंट्स को टैबलेट्स देके उनकी बीमारी कंट्रोल कर सकते हैं, क्योर कर सकते हैं. फिर अभी इम्यूनोथेरेपी की खोज हुई है जिसमें हम इंजेक्शन देते हैं, वो इंजेक्शन जो सीधा जाके कैंसर को नहीं मारते हैं लेकिन पेशेंट की खुद की इम्यूनिटी को एक्टिवेट करते हैं ताकि पेशेंट के इम्यून सेल्स जाके कैंसर से लड़े. तो उसमें साइड इफेक्ट्स कम होते हैं, कम पेनफुल थेरेपी है. तो बहुत सारी एडवांसेस हो रहे हैं, बहुत सारी नई नई दवाएं खोजी जा रही है, और इससे हम आशा कर सकते हैं कि अगले 10 साल में, अगले 20 साल में ट्रीटमेंट कम पेनफुल होगा, कम दर्दनाक होगा. जब आपने पूछा कि बेस्ट ट्रीटमेंट क्या है, तो क्या होता है कि हर एक का कैंसर एक तरीका नहीं होता है. अगर 10 पेशेंट है ब्रेस्ट कैंसर से पीड़ित, तो हर एक का ब्रेस्ट कैंसर अलग तरह का होता है. पेशेंट की उम्र क्या है, पेशेंट का ट्यूमर का साइज क्या है, वो कहाँ तक फैला हुआ है, उसमें रिसेप्टर्स है कि नहीं, कौन से रिसेप्टर्स है, ये सारी चीजें देखकर फिर पेशेंट का ट्रीटमेंट प्लान बनता है. तो ऐसे नहीं होता है कि एक ट्रीटमेंट सबको काम आए या सबको एक तरह की ट्रीटमेंट से हम क्योर कर सके. हर पेशेंट का ट्रीटमेंट अलग होता है, हर पेशेंट का कंडीशन अलग होता है, स्टेज अलग होता है, और इसको आज की भाषा में हम पर्सनलाइज्ड मेडिसिन कहते हैं कि हर पेशेंट का वहाँ. अब तो हम सिर्फ ट्यूमर को माइक्रोस्कोप के नीचे नहीं देखते, तो उसके जेनेटिक लेवल तक जाते हैं कि पेशेंट के जीन्स क्या है, कौन से जीन्स एक्टिवेट हुए हैं, कौन से जीन्स सप्रेस हुए हैं, क्या हम बुरे जीन्स को और दबा सकते हैं, कि हम अच्छे जीन्स को एक्टिवेट कर सकते हैं. तो बहुत सारी एडवांसेस हो रही है, और बहुत सारे एडवांसेस होने की हम आशा रखते हैं. तो अगले 10, 15, 20, 30 साल में हम आशा करते हैं कि ट्रीटमेंट जो होगा वो सरल होगा, आसान होगा और कम दर्दनाक होगा.
जी, थैंक यू सो मच डॉक्टर. जी कृष्णेंदु.
मैम, वन मोर क्वेश्चन.
हम्म.
मैंने कहीं पे रिसर्च पढ़ी थी, इट्स अ यूएस बेस्ड रिसर्च, कि वहाँ पे 6 ऐसे पेशेंट्स हैं जिनको स्टेम सेल्स के थ्रू ट्रीटमेंट किया गया. सो क्या इट्स अ फैक्ट और इट्स अ लाइक अ ओनली जस्ट रिसर्च?
तो स्टेम सेल कई तरह के होते हैं। जब हम बोन मैरो ट्रांसप्लांट करते हैं तो उसे भी स्टेम सेल ट्रांसप्लांट ही कहा जाता है। तो आपने जो सुना है वो मैं नहीं जानती एग्जैक्टली कौन से तरह के स्टेम सेल्स है, लेकिन बोन मैरो ट्रांसप्लांट भी एक तरह का स्टेम सेल ट्रांसप्लांट है जो कि ब्लड कैंसर के पेशेंट के लिए और भी कहीं सॉलिड ट्यूमर कैंसर्स के लिए अभी कई सालों से किया जा रहा है। अलग तरह के स्टेम सेल्स पे भी बहुत सारा रिसर्च हो रहा है। अभी भी जो ट्रीटमेंट है वो क्लिनिकल ट्रायल्स में हो रही है। ऐसे कोई कमर्शियली अवेलेबल स्टेम सेल थेरेपी नहीं है, लेकिन आशा है कि अगले 10, 20, 30 साल में वो भी आ जाएगा।
जी जी, थैंक यू सो मच डॉक्टर, थैंक यू कृष्णेंदु। कृष्णेंदु से बातें करके
I just need want to ask, कृष्णेंदु said कि पेन क्यों नहीं कम होती, पेन बहुत होती है। तो जब हम पैलिएटिव केयर को इसके साथ लेके आते हैं, हम पेन का सिर्फ फिजिकल कंपोनेंट नहीं देखते, पेन के और भी कंपोनेंट्स है, लाइक स्पिरिचुअल कंपोनेंट, सोशल कंपोनेंट, इमोशनल कंपोनेंट।
जी, आई वाज जस्ट कमिंग टू दैट।
या उसको भी ट्रीट करने की जरूरत है। हम जब उन कंपोनेंट्स को ट्रीट करते हैं तो पेन में डेफिनेटली बहुत फर्क आता है उस पेशेंट के।
नहीं डॉक्टर परमजीत, आई वाज जस्ट कमिंग टू दैट ओनली, एंड थैंक्स दैट यू ब्रॉट इट अप कि मतलब जो मानसिक अवस्था होती है क्योर होने के बाद भी, क्योंकि फिजिकली बहुत चेंजेस होते हैं, मेंटली बहुत चेंजेस होते हैं। आप काफी टाइम तक आपको बोला जाता है कि आप घर पे रहिए, बाहर ज्यादा मत जाइए, स्पेशली अभी तो कोविड भी है, तो आपकी इम्यूनिटी वीक है, आप ये नहीं खा सकते, आप वो नहीं खा सकते। तो उन सारी चीजों से जूझने के लिए व्हाट आर द व्हाट इज द एडवाइस फ्रॉम डॉक्टर्स लाइक योरसेल्फ एंड डॉक्टर अनुपमा एंड डॉक्टर केदार?
तो इफ आई टॉक अबाउट दिस, जो मेंटल स्टेटस है वो तब से शुरू हो जाता है जब हम फैमिली को ब्रेक करते हैं या पेशेंट को ब्रेक करते हैं कि उसको कैंसर है। उसी टाइम जब न्यूज, उसको बैड न्यूज हम ब्रेक करते हैं, उसी टाइम से उसका मेंटल लेवल जो हिल जाता है कि ये मुझे क्यों हो गया। या हो सकता है जैसे मुन्ना भाई में एक एग्जांपल थी, वो स्टमक कैंसर में वो कहते हैं मैं तो शराब भी नहीं पीता, मैं तो स्मोक भी नहीं करता था, मैंने कभी कुछ नहीं किया, तो मुझे कैसे कैंसर हो गया। सो देयर आर सो मेनी क्वेश्चंस दैट स्टार्ट फ्रॉम द टाइम जब न्यूज ब्रेक होती है। उसके बाद जब जैसे जैसे प्रोग्रेशन होता है, हम तभी बोलते हैं अगर पैलिएशन साथ में शुरू हो, हम साइड बाय साइड पेशेंट की काउंसलिंग सेशंस करते हैं, उनको थेरेपीज देते हैं, जिससे पेशेंट का माइंडसेट उस फॉर्म में पॉजिटिव टुवर्ड्स पॉजिटिव जाता है। एंड देन वी मेक देम मीट विद द कैंसर सर्वाइवर्स कि हाँ, अगर ये ठीक हो गया तो मैं भी ठीक हो सकता हूँ।
जी,
जैसे हम किसी से बात करते कि अच्छा मुझे प्रॉब्लम, अच्छा इसको भी प्रॉब्लम है, तो हमें वो दर्द कम महसूस होता है। वैसे अगर ये ठीक हो सकता है तो मैं भी ठीक हो सकता हूँ। एंड देन डेफिनेटली वहां पे हम वैसे पतले होने के लिए भी तो डाइट लेते हैं ना, तो व्हाई नॉट टू फॉलो, अगर पोस्ट कैंसर हमें डाइट मिल रही है। प्लस वी कैन ऑलवेज फोकस ऑन द ग्रुप डिस्कशन पोस्ट रिकवरी कि जो जो सर्वाइवर्स हैं या जो उनके डॉक्टर्स हैं, जो उनके ऑन्कोलॉजिस्ट हैं, जो उनकी थेरेपिस्ट है, दे कैन ऑलवेज हैव अ ग्रुप डिस्कशन एंड दे कैन ऑलवेज टॉक टू द पेशेंट, क्योंकि बात करने से भी बहुत रिलीफ मिलता है पेशेंट को। देयर इज समवन हु इज लिसनिंग टू द पेशेंट and there is someone who is doing something for the patient. So we can always focus on these things and making, and definitely the patients who get recovered, अगर वो उनसे मिलते हैं तो उनको बहुत पॉजिटिव आती है। जैसे पूनम मैम was said कि उनको चैट में लोग पूछते कि कैन वी चैट और कैन वी टॉक टू यू, जिसको अर्ली डिटेक्ट हुआ है कैंसर या कुछ भी हुआ है, तो दैट गिव्स अ पॉजिटिव रे ऑफ अप्रोच टू देम पेशेंट्स, एंड देन डेफिनेटली उनकी उस मेंटल लेवल पे बहुत फर्क पड़ता है।
जी बिल्कुल। मिस नंदा, आई नो मैं आपसे भी पूछना चाहती थी कि आप अपने ऑर्गेनाइजेशन के द्वारा हाउ डू यू काइंड ऑफ motivate patients through the journey and then post the journey? What are the new things that you're trying? What are the what kind of successes have you seen? Could you elaborate a little bit on that?
See, in our organization, the most, as I would say, Jita Jata Udharan is UV himself. Okay, they cannot be a more inspirational story than UV's, because to fight disease, go through this, and UV's treatment was actually very, very intensive. His chemos used to last 3 to 4 days, as you know, and very painful, very lot of side effects and all. Anyways, to cut the long story short, he came back and he was determined to get back into the Indian team, and he probably gave some of his best performances post cancer. So when we, encourage people, when we tell them exciting stories, and we don't have a better story than And then, of course, with the women, I tell them my story. I tell them that, I've been through it twice. And what saved my life was early detection and being aware because my mom had cancer. My mother had
Hmm.
breast cancer. So I knew I was, somewhere on the hit list. So it didn't come as a total surprise because I was mentally prepared that, somewhere in the genes it is there. And now, more than myself, I worry about my children. So these are the things that you need to be aware of, and the more we talk about it, the more we come out in the open, and especially things like breast cancer and cervical cancer. Forget about the rural areas. I think Dr. Kedar and Anupama would agree that even in the urban area, people don't want to talk about it. Going for a
True.
mammogram, my God, the amount of myths they have around the mammogram about chemotherapy. So many people told me, don't go into chemotherapy. नहीं भी कुछ होना होगा तो भी हो जाएगा. These are the kind of myths. So the more we talk, the more we get them to be aware, the more we, get rid of these superstitions कि आप ये जड़ी बूटी खा लो तो ठीक हो जाएगा या आप इतने
Hmm.
दिन व्रत
Hmm.
लो तो
Yeah.
हो जाएगा. कुछ नहीं होने वाला. Unless you go to
Okay.
people like Kedar or Anupama or Paramjot, it's not going to work. You just
Yeah.
have to take that route.
Yeah.
I'll
So,
just
Doctor,
like to add on. I'll just like to add
yeah,
on. We
please.
have to make it an integral part of our education system, right from the school. In our schools, we have got something called Rashtriya Bal Suraksha Karyakram (RBSK) programs. So, in case we can educate them right from the school, what's the importance of this. The girl child could be educated, or the whole the students could be educated with regards to adolescent health, with regards to sexual health, with regards to cancers, with regards to your dietary habits, would be a nutritional supplements. That's a very important thing we have to target. Second important, as all the panelists have already spoken about, the mental health. Mental
Ji.
health is an integral part of the whole system.
Yes.
My father was a surgeon. My father was a surgeon by profession. Lost him early. He was colonic cancer. Died of colonic cancer, and being surgeon, he could not detect it. So the amount of trauma we as a family, my mom also is a doctor, she still practices. So the amount of mental trauma we had gone through, the referrals going to Tata Hospital, coming back, the forward. I mean, there was absolutely no counseling happening to us. I was doing my medicine in my second year of my MBBS, and there was absolutely no counseling. I mean, I would see my father sitting on the table trying to have food, and he should not eat anything. So that again, looking at him, we were not able to eat anything. So the amount of counseling that is required, the amount of patient separate counseling. There is something called family counseling that should be the integral part of the whole system. The palliation has to be again. I mean, there are 12 different components under health and wellness center component. One of the components is the cancer. So palliation, the end of life treatment, all those things have to be integrated at the level of. At least not at the level of a tertiary hospital, at least at the level of district hospital. In case we have got a
Ji.
strong medical setup happening at a district hospital or at a community health center level, and a proper training, a right approach, and right from strong educational, integrating it in the education system, right
Hmm.
to having a proper counseling setup, right to giving the right information at the right place at the right time. Definitely, we can fight any type of cancer. That is what my take on this is.
No, and I would really
Just one,
request, I mean,
yeah,
sure.
just one little point, Sneha. What I'd like to say is that they were talking about family counseling, and that is so important because we've just started this
Absolutely.
campaign called Freedom to Dream, and we are going to
Hmm.
different hospitals in the pediatric wards. And the more counseling, the max counseling you have to do is of the parents. You have to tell them that this is not the end of the, because the moment they hear बच्चे को cancer हो गया, they think that it's the end of the road. कुछ नहीं कर सकते, कुछ नहीं होगा. So that's what we are, constantly telling them that they have the freedom to dream about their lives. They have goals, they have ambitions. Please don't stop anything in their lives just because they've been stuck with cancer. Why should
No,
Krish not have his aspirations? I mean, just because he went through cancer, why should he give up on his dreams? He has
absolutely.
every right to want to get there when he wanted to, before the disease got up with him. That's what I want to
Some
say.
wonderful things said, Miss Nanda. I wanted to, hear from Krishnendu. Krishnendu, since there's so much, हमने बहुत serious बातें कर ली, तो हम जानना चाहते हैं आपसे थोड़ा, we want to get the positive side of it, कि आज आपकी जिंदगी कहाँ है, क्या कर रहे हो आप अपने health का कैसे ख्याल रखते हो, और how is life post the treatment?
Uh, First of all, I am a medical lab technologist in Department of Pathology, All India Institute of Medical Sciences, and मेरी हेल्थ का क्या वो है कि मैं प्रॉपर अपना डाइट वगैरह रखता हूँ एंड प्रॉपर जो भी है मैं घर का ही खाना यूज प्रेफर करता हूँ फर्स्ट। देन अगर कभी कुछ बाहर दोस्तों के साथ हुआ तब मैं आउटसाइड फूड एंड ड्यूरिंग आफ्टर मेरा मेरी लाइफ जर्नी अभी मैं मेडिकल लाइन में हूँ। सो मेरा स्टार्टिंग से फोकस यही था कि मैंने स्टार्ट फर्स्ट मेरे को पता नहीं था जब मैं 5 साल का था तब मैं फॉलोअप के लिए जा रहा था तो फादर से मैंने पूछा कि
जी
मुझे बार बार ये टेस्ट क्यों करवाने आने होते थे और क्यों मुझे ऐसा वो सुइयां लगती है। तो
जी
पापा ने उस टाइम हंस के कुछ नहीं बताया। देन
जी
जब मैं दोबारा फॉलोअप के लिए डॉक्टर के पास गया तो उन्होंने मेरे को जो है मेरे को बात नहीं बताई बट
जी
मैंने साइड बाय साइड मैंने सुना कि मुझे ये तब मुझे इसके बारे में पता नहीं था। तो
जी
उसके बाद 2008 में जब मैं एक एनजीओ से जुड़ता हूँ कैन किड्स कैन एंड उसके सर्वाइवल ग्रुप से जुड़ता हूँ उनके साथ सोशल वर्क करता हूँ। देन धीरे 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 मुझे पता चलता है कि व्हाट इज द कैंसर एंड व्हाट इज द साइड इफेक्ट्स। और मेरे साथ जो हुआ था वो मैं एक पार्ट ऑफ कैंसर।
जी
तो उस टाइम मुझे जो है मैं अपना गोल सेट करता हूँ कि मुझे मेडिकल लाइन में ही परस्यू करना है। तो तब मेरे पास इतना 2008 में जुलाई में मेरे फादर वो हो गए पास्ट हो ही डाइड बिकॉज ऑफ लो शुगर। उनकी शुगर हाई करने के चक्कर में दोनों किडनीज फेल हो गई। देन 1 वीक के अंदर वो भी चल बसे। देन मैं पूरा डिप्रेशन में था। देन धीरे धीरे मैंने अपने आप को स्ट्रॉन्ग किया रिकवर किया। देन फिर मैंने आफ्टर 10th मैंने दिल्ली पॉलिटेक्निक में अप्लाई किया। मेरे को गवर्नमेंट कॉलेज नहीं मिला दैट्स वाई मैंने उसको क्विट करके अपने 11th 12th परस्यू किया नॉन साइंस। देन आफ्टर 12th मैंने सेम चीज़ वो की परस्यू की। मैंने अपना डिप्लोमा किया इन मेडिकल लैब टेक्नोलॉजी। देन फिर उसके साथ मैंने एम्स में भी वर्क किया एज अ लैब असिस्टेंट डिपार्टमेंट ऑफ हेमेटोलॉजी इन प्रोजेक्ट। तो उससे मेरा इंटरेस्ट पड़ा कि मैं ग्रेजुएशन करूं। नाउ आई एम ग्रेजुएटेड विद बीएससी इन मेडिकल लैब टेक्नोलॉजीज एंड currently working in डिपार्टमेंट ऑफ हेमेटोलॉजी एज अ एमएलटी। सो मेरे एक उसने ही मुझे इतना बड़ा गोल दिया कि मैं इससे अपने आप को आगे स्टैंड कर सकूं।
जी
एंड मेरा लास्ट कमिंग 2 years का गोल ये है कि मुझे एमएस करना है इन मेडिकल मेडिकल molecular medicine. So I'm preparing for that. मैं जर्मनी से करना चाहता हूँ तो मैं
जी
अप्रोच कर रहा हूँ जर्मन इंस्टीट्यूट एंड साइड बाय साइड मैं अपने आईएलटीएस एंड जर्मन लैंग्वेज की भी प्रिपरेशन।
Gee. And good luck to whatever you have planned, and your inspiration to all the audience that we have today कि वो कैसे अपने लाइफ को आगे बढ़ाए and लाइफ को नॉर्मल रखे. So all the best with whatever you do
I would like
whatever
to
you plan.
just add on a big salute to you, sir. I
Yes,
mean,
yes,
थैंक यू
so
सो
much
मच सर।
you achieved in whatever span of time. A big salute.
yeah, yeah.
थैंक यू। मैं ये चीज हमेशा करता हूँ अपने साथ नेवर गिव
जी
अप। बट मेरी भी हिम्मत कभी कभार टूट जाती है बट मेरे आसपास कुछ लोग हैं जो मेरी हिम्मत हमेशा बढ़ाते हैं। सो आप ऐसे लोग के साथ कनेक्ट हुए जो आपकी हिम्मत टूटने ना दे। इन केस अगर कभी टूट भी जाती है तो आप उनसे डिस्कस करें, दे विल मोटिवेट।
Rightly said, Krishnendu, and thank you so much. Last, we have like a couple of minutes to go. Last round of questions to Dr. Anupama, Dr. Paramjo, Dr. Kedar. How important is it to keep your health in check? Because you're talking about Azadi. So basically, Azadi is the freedom to live post getting cured. So, how important, and your advice to people out there, families out there who are listening to this, watching this conversation, how do you maintain your health, your mojo after the treatment, doctor?
So, Krishnendu, you want to say something?
यस मैम.
जी
सॉरी
प्लीज बोलिए.
एक और चीज मैं बोलनी थी कि आप कभी एज अ कैंसर पेशेंट और एज अ कैंसर सर्वाइवर, अगर आप अपने आप पे अपने आप पे भरोसा करते हैं तो उसको कभी भी मत टूटने दीजिए. एक गोल सेट कीजिए कि आपको ये करना है और उस गोल पे आप वर्क कीजिए.
Absolutely.
दैट्स इट. थैंक यू.
Thank you so much, Krishnendu. Yes, thank
I
you so
think it is.
much.
Thank you, Krishnendu. You are an inspiration. Yes. So we try to do the same thing for our patients. At the end of treatment, we tell them that yes, you have been through a lot, you have emerged victorious, and now it is in your hands to take good care of yourself. Okay.
Sure.
So we all have our goals, our careers, our families, but we have to remember that unless we are healthy, we will not be able to contribute towards the well-being of our families, towards society. So it is very, very important that we should give adequate importance to our own health. And by importance, I mean take out enough time for yourself, for exercising, for whatever it is. But we cannot ignore our health and give the excuse of careers or any other thing. Second thing is, a healthy lifestyle includes diet, exercise, and most importantly, something which our forefathers and our culture and heritage has given us, which is the practice of yoga, pranayam, and meditation. There is nothing like these three things which will help to boost immunity, to maintain mental calmness, and to give us the inner strength to fight challenges. So it has been scientifically proven time and again that by doing meditation, by doing pranayam, and by doing yoga, you can get your body to its highest level of immunity. Of course, it has to be supplemented by good diet. But this is something which we have inherited by being Indians, by living in this country. And we should value it and we should practice it. I tell all my patients at the end of therapy that your health has to be your priority. You have to have a good diet, balanced diet, do all these things for stress management. And of course, for youngsters, I always tell them, and I tell them in front of their parents, that you have to stay away from tobacco, alcohol, and drugs. And I think we should not take it for granted that they will understand. It has to be spelled out for every follow-up session when they come, whether they are with their parents, whether they come alone, whether they come with their spouses, whether with their girlfriends, boyfriends. I insist on this, that you have been given a new lease of life. You have been cured of cancer, and it is up to you to take care of your health now. So, good diet, good stress management practices, and to stay away from tobacco, alcohol, and drugs.
Right, right. Dr. Paramjo, would you
Just,
like to?
Yeah,
Sorry.
yeah. Actually, ma'am has already covered the most
Yeah,
of the things. And then
yeah,
you should have a positive mindset. First, we always say is to have a good positive mindset. And then listen to your body. If you feel something is not good, if you feel lethargic, take rest, take a nap. Nothing is going to happen. Take a break, go for vacation, and then start
yeah.
with early detection in case of palliation. Have good diet, have 5 portion of fruits and vegetables in your diet, have good naturopathy sessions, aromatherapy sessions, music therapy sessions to calm your body, mind, and soul. So this is what I want to add in this, and mostly ma'am has already covered.
Sure.
yeah,
Dr.
as
Kedar.
ma'am has covered a few things, is important to have a good family time. Get connected
Absolutely.
to your family. Spend time with them. It should be healthy discussion. As Krishnendu rightly said, speak to people who motivate you constantly. Be in touch with them. Stay away from the negatives. And definitely, we are also having different campaigns in Goa. We have got something called Eat Right campaign, which we have started in school. So that's one of the campaign we are trying to do it with dietary education. Then we have in roped in. I mean, we are in partnership with iPress. We are doing that particular program. So also we have got many other programs. We're collaborating with different this as a nodal officer. I'm saying that's what the state of Goa is doing with regards to implementation. But important thing is be positive, have a positive mindset, and be with good people around. Take your breaks regularly, and give time for yourself. That's very very important. If you don't give time, then I mean it's nothing like that. I mean, you have to give time for yourself and your family.
Right, and just to like kind of wrap things up here, for these, thank you for the valuable insights, everybody. Miss Nanda, I would like, really like, as Daily Hunt, we would be one of the contributors in spreading the word around, and all that was discussed today. If we can get more and more literature around whatever was discussed and more for our audience out there. And Ms. Nanda, like last few words from you about UVCAN's journey so far and what you plan to do ahead.
Well, it's been a beautiful journey. It started because somebody was unfortunate enough to get cancer, but then that person decided to do something and give it back to the society because he realized how important it was. So we just a couple of months ago finished our mission 1,000 beds. During COVID, we digressed from cancer, and we were actually able to provide various hospitals with 1,020 ICU beds along with all the infrastructure that goes with it. So that was a major contribution that UBCAN was able to do, and we are so extremely proud of that. And now people like Anupama and Kedar are looking after the the Goa project, First Mahilas First Goa project, and I think that's going to be a path breaker, and I hope that the rest of the states will follow our example and have it done over there. So these are the dreams that we have. And me personally, I'm very strongly connected with women who go through this difficult time, and we are always there to help them and tell them that this is not the end of the world. I mean, God will give you enough energy. God will give you enough support from the medical fraternity. I told my doctor, once I found my doctor, I told him, अब आप जहर भी दे दोगे ना तो मैं वो भी खा लूंगी, because I have implicit faith in you and I will do exactly what you tell me to. So these are the positive mindset, as both the doctors, all three doctors said. That's very important. Of course, some people are unfortunate. They get to the treatment too late, and even great doctors cannot. Look at what happened to Steve Jobs. He had the world at his feet, but he couldn't beat it. That's probably because the disease was beyond repair. So पर अब कैंसर का वो बुखार और वो फोबिया नहीं है. It is treatable provided you find it early, and the whole world is there to help you out with this journey. And we at the foundation, especially so, are committed to support and help in whatever way we can. So that's my two penny message to everybody who's listening.
Right, and we're privileged, Daily Hunt, to have you, all of you, discussing this issue, and Krishnendu, especially you, for sharing your journey so honestly with us.
Yes.
And we hope to get more insights going forward and spread the message to our audience that we have across languages. So, and hence actually kind of justify the Azadi from this ailment going forward, and not just the ailment, but just have myths busted around this going forward in a very positive way for everyone. Thank you so much, and thank you MASH Foundation for organizing this. Thank you everyone, it was a privilege talking to all of you. Thank you.
Thank you for having us.
Thank you for having
Thank
me.
you,
Thank you.
everyone. Thank you. Bye.
Bye.